Okay, bonjour et merci de vous être.
Hello, and thank you for joining us today.
Today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, from the Deputy Chief Public Health Officer, Dr. Haroun, from the Minister of Public Services and Procurement, Anita Anand, by video link from our Minister of Innovation, Science and Industry, Navdeep Bains, et bien sûr du Président du Conseil du...
And of course, the President of the Treasury Board, Jean-Yves Duclos.
Good afternoon, bonjour à toutes et à tous. I will start with the latest numbers on COVID-19 in Canada. There are now 92,157 confirmed cases, including 7,344 deaths, and 50,070 cases, or 54%, have now recovered. Labs across Canada have tested over 1,721,000 people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of close to 29,000 people daily. As hard as the last months have been on all of us, these times have brought additional challenges for some people more than others, including people with disabilities. For some people with disabilities, older age or underlying medical conditions put them at greater risk of serious complications related to COVID-19. Add to this the additional challenges that most face when accessing information, social services, transportation, and healthcare, at a time when there has been an overall reduction in service availability over the last several months. This week, we mark National Accessibility Week. This is a time to promote accessibility and inclusion, and to celebrate the many contributions of Canadians with disabilities. At the same time, we also recognize the efforts of individuals, communities, and workplaces who are taking action to remove barriers and ensure that people with disabilities have an equal chance to participate in all aspects of society. There is much we can learn and gain from greater inclusion of the disability community. It is thanks to their ongoing efforts to create greater accessibility of services and spaces that we all now benefit from accommodations, like having groceries delivered to our homes and working or learning remotely. In Canada's response to COVID-19, we have been working hard to ensure that the needs of people with disabilities are taken into account. This includes engaging national disability organizations, as well as other experts and stakeholders. We have also produced guidance on disability considerations to enable healthcare providers to adapt their approaches and support people with disabilities in accessing services. Today, I would especially like to thank all the sign language interpreters who have been with us every step of the way. Through their work, we are able to convey important information to Canada's deaf community. Thank you. Merci.
Thank you, Dr. Tam. Okay, maintenant je donne la parole à Dr. Haroun.
I will now give the floor to Dr. Haroun. Please go ahead. Thank you. Hello. I will start with the latest numbers on COVID-19 in Canada. There are now 92,157 cases and 7,344 deaths, and 50,070 people have recovered, which is about 54%. Labs across Canada have tested 1,721,000 people. Approximately 5% of those tested positive overall. Over the last week, we have been testing an average of 29,000 people a day. The last months have been hard on us all. However, these times have brought additional challenges for some people more than others, including people with disabilities. For some with disabilities who are older or who have underlying medical conditions, they are at a greater risk of serious complications related to COVID-19. It is also often more difficult to access information, social services, transportation, and healthcare at a time when there has been an overall reduction in service availability over the past several months. This week, we mark National Accessibility Week. This is a time to promote accessibility and inclusion. It is also a time to celebrate the many contributions of Canadians with disabilities. We recognize the efforts of individual communities and workplaces who are taking action to remove barriers and ensure that people with disabilities have an equal chance to participate in all aspects of society. There is much to learn and to gain from greater inclusion of the disability community. It is thanks to their ongoing efforts to create accessibility of services and spaces that we all now benefit from accommodations such as having groceries delivered to our homes and being able to work and learn remotely. In Canada's response to COVID-19, the needs of people with disabilities are taken into account. This includes engaging national disability organizations, as well as other experts and stakeholders. We have also produced guidance on disability considerations in order to enable healthcare providers to adapt their approaches and to support people with disabilities in accessing services. Today, I would especially like to thank all of the sign language interpreters who have been with us every step of the way. Through their work, we are able to convey important information to Canada's deaf community. Thank you.
Merci, Dr. Kno.
Thank you, Dr. New.
We'll hear from our Minister of Public Services and Procurement, Anita Anand. Anita, please.
Thank you, Christia. Good afternoon. While this has been a particularly difficult week, I will begin by thanking Canadians across the country, especially our frontline healthcare workers who have risen to the challenge, continually placing the interests of our communities above all else. Their unwavering commitment is literally saving lives, and as a result, communities are emerging from strict restrictions. Toutefois, il est important.
However, it is important to remind ourselves that Canada is not yet completely out of the woods. We must be ready to respond to a new increase as well as to a possible second wave.
Discuss supply chains. As I have said from the beginning, our approach is twofold: to buy aggressively and to diversify our supply chains. As a result of our government's aggressive procurement strategy, we are now receiving millions of items of protective equipment every week, with deliveries set to continue for the months to come. Moving forward, our focus on diversifying supply chains, particularly in terms of domestic production, allows us to better adapt to external market volatility. In terms of procuring equipment and supplies, our plan remains to meet short-term and anticipated long-term needs as the pandemic evolves. This is why we have placed large orders in bulk, and we continue to make additional procurements to meet Canada's immediate needs and to prepare for the future. C'est grâce à cette approche mixte que
It is thanks to this hybrid approach that we are observing more regularity and stability in our supply chains, in spite of increasing worldwide demand.
we've received 500,000 N95 masks from 3M in each of the last 2 months, and we await delivery of more. These deliveries are in addition to the large quantities of N95 masks that 3M is providing directly to the provinces and territories on a regular basis. In terms of planning ahead, while researchers around the world are working quickly to develop a vaccine, our government is already preparing. I am pleased to announce that we have signed a contract with Becton Dickinson Canada for 37 million syringes in this regard. We are also continuing to work to procure other supplies needed for eventual mass vaccinations on a systemic level. We are making sure that when a viable vaccine is discovered, Canada is ready for its administration. Moving to international shipments. Over the course of the last few months, Canada has brought goods back home from international destinations. China, Ireland, and Malaysia are some of the countries that we are continuing to procure from. These shipments are now arriving by different means of transportation. Early this morning, for example, the 51st plane chartered by our government to bring PPE home from Shanghai is now en route to Canada. These shipments are in addition to the commercial flights on which Canada frequently secures space for PPE cargo. Aussi cette semaine, le premier navire.
This week, the first ship carrying large quantities of hand disinfectant will dock at the port of Vancouver. 4 more ships are already on their way. They are also carrying millions of additional liters of disinfectant.
PPE update on individual items. From the beginning of this pandemic, we have maintained one driving priority: to keep Canadians, especially frontline healthcare workers, safe and healthy. Our efforts at home and abroad are paying off. Gloves. In terms of aggregate PPE supplies from all sources, over the past 10 days, we more than doubled the number of gloves received to nearly 40 million pairs. Gowns. We also doubled the number of gowns received to just over 3 million, with deliveries coming from Canadian companies such as Yoga Jeans, based in Saint-Laurent, Quebec. Surgical masks. I am also pleased to report that we have now surpassed the 100 million mark of surgical masks received, including large deliveries from Primed, headquartered in Edmonton, Alberta. Face shields. In addition, we have received nearly 3 million more face shields over the past week. More than half of the nearly 10 million face shields in aggregate received to date were made right here at home in Canada, including from companies such as the Canadian Shield, Jacobs & Thompson from Toronto, and the Windsor Mold Group. I will take a moment now to highlight the incredible story of the Canadian Shield, based in the Waterloo region. Before the pandemic hit, the Canadian Shield's parent company, Inksmith, was producing 3D printers, laser cutters, and high-tech instruction materials for schools. When asked if the company could use its technology to produce much-needed face shields, it met the challenge head-on. The Canadian Shield expanded from just 10 employees to more than 200, working around the clock to meet the high demand for its product. So far, the Canadian Shield has provided the federal government with more than 1.2 million face shields, with more on the way. This is an example of the several innovative Canadian companies that are helping Canadians fight COVID-19 while also sustaining and even creating local jobs, allowing Canadians to get back to work. Toutes ces compagnies livrent.
All of these companies are now delivering the goods, and not just at the federal level, to provinces and territories, as well as healthcare facilities. They are all getting supplies directly from some of these providers or from other sources. Throughout the government, working with provinces and territories, we are exploring different ways of contributing to the effort of accessing personal protective equipment for buyers and sellers within the Canadian market. As the pandemic evolves, all Canadians can be certain that the government remains determined to ensure that personal protective equipment and other supplies will continue to be delivered to provinces and territories, so that the women and men working on the front lines of the health sector have the equipment that they need to ensure the safety of all Canadians.
To thank the employees of Canadian companies who have stepped up during this very challenging time to make essential supplies. The work that you and your businesses are doing to manufacture supplies right here in Canada is quite literally saving lives. As demand goes up, Canada is keeping up. Thank you so much. Merci beaucoup.
Okay, thank you very much, Anita. And now we will hear from our Minister of Innovation, Science and Industry, Navdeep Bains. Nav, please.
Christia, and good afternoon. From the very beginning, our government has refocused existing programs to mobilize industry and deploy resources to support Canadian companies as they develop innovative solutions, made in Canada solutions to fight COVID-19. And today, I have good news to share around the work being done to expand the COVID-19 testing. Comme vous pouvez l'imaginer,
As you can well imagine, Canada needs different types of tests to meet the different volume and capacity requirements needed to effectively diagnose and to understand the spread of the virus.
it is essential that testing occur in a variety of settings, including centralized environments, through hospital or testing laboratories, and in more localized point-of-care settings, such as local clinics, long-term care homes, and our more rural and remote communities across the country. A few weeks ago, we launched our point-of-care diagnostic test kit challenge. We asked small and medium-sized businesses to each create a rapid testing kit, comparable to other non-COVID tests that will diagnose individuals affected by COVID-19. And we have now selected 4 companies who will receive funding from the National Research Council of Canada to put their expertise and research and development capabilities towards providing potentially breakthrough solutions for COVID-19 rapid testing kits. Deep Biologics from Guelph, Ontario, Forian from Edmonton, Alberta, Metabolic Insights based in Kelowna, BC, and Nicoya in Kitchener, Ontario. These 4 companies will receive government funding in response to phase 1 of the challenge. These tests, if approved, would diagnose individuals affected by COVID-19 within 3 days of the start of their symptoms using an easy-to-collect patient sample rather than that uncomfortable nasal swab. Instead, these companies have found a way to detect the presence of the COVID-19 virus in saliva, which is less invasive method than the nasal swab or the taking of a blood sample. As part of phase 1 and within 3 months, the 4 selected companies will bring their expertise and research and development capabilities to each prove feasibility of the proposed solution for a rapid single-use testing kit. Les entreprises qui vont avoir de ce
If companies receiving Phase 1 funding are successful, they could be considered for Phase 2. If so, they could receive up to $2 million for up to 12 months to then develop a prototype of their proposed solution.
work we're funding through Innovative Solutions Canada in partnership with the Public Health Agency of Canada and the National Research Council of Canada. Joining these 4 companies, I'm pleased to announce an investment of nearly $5 million, this time through the NGen Supercluster, which will boost our capacity to actually manufacture point-of-care test kits right here in Canada. Precision Biomonitoring from Guelph is partnering with Ottawa's EVIC Diagnostics to establish a manufacturing facility here in Ontario. Ces nouvelles installations permettront
This new facility will allow precision biomonitoring to offer manufacturing capabilities to other Canadian biotech firms.
And as we said from the start, collaboration is our best strategy to help Canada emerge from the pandemic as strong as possible. And on that note, I want to thank the members of the new Industry Strategy Council who will join our chair, Monique Leroux, to share their perspective on the challenges being faced across our industries. Over the coming weeks, the Council will serve as a forum to hear from and collaborate with well-respected industry leaders to assess the scope and depth of the COVID-19's impact on industries and identify the specific sectoral pressures. I have every confidence that we will continue to deliver as we work together with Canadian business community to meet the demands now and into the future. Thank you very much. Merci beaucoup.
Okay, thank you very much, Nav. Et maintenant, je donne la parole.
I will now give the floor to the President of the Treasury Board, Jean-Yves Duclos. Jean-Yves, please.
Thank you, Christia. And hello, everyone. The message from the Prime Minister this morning focused on the importance of being leaders and allies. First of all, in the context of fighting racism, as well as systemic racism throughout Canada, as elected officials, Canadians expect us to be leaders, and as citizens, we also have the responsibility to be leaders and ensure that everyone can live in dignity and safety. We also have to be leaders and allies in the fight to have a solid relaunch of our economy. Minister Baines talked about Monique Leroux and the Industrial Strategy Council. That's going to be led by 9 members of the community who will be leaders and allies to help us get through these significant disruptions by the structural and economic circumstances we've been experiencing. We are grateful for this work to support the Canadian government and to quickly move through the crisis.
Okay, merci beaucoup, Jean-Yves.
Thank you very much, Jean-Yves. We are ready for your questions.
Merci, Madame la Vice-Première Ministre.
Thank you, Deputy Prime Minister.
On the phone before we turn to the room. Operator, over to you.
The question is from Lee Bertium with Canadian Press. Please go ahead.
Yes, hi. This question is for Minister Freeland. Given that you've made protecting journalists a foreign policy priority, including in a joint effort with Britain, what do you think about the violence that has been directed at American journalists right now? And how responsible is President Donald Trump for his anti-media rhetoric, calling journalists enemy of the people, for inflaming that?
Thanks for the question, Lee. And it's something that I have been thinking about a lot. Journalists are not the enemies of the people. Journalists serve the people. Speaking from my own experience in government, I cannot say that every single question that I am asked by a journalist is welcome or easy to answer. But I am absolutely convinced that the fact that journalists are present to bear witness, the fact that journalists are present to hold governments to account, makes governments better. So freedom of the press is an essential human right, and it is an essential element in making democracy strong.
En français, s'il vous plaît, Madame la Vice-Première Ministre.
In French now, please, Deputy Prime Minister. That is a very good question. As a journalist and a politician today, I've reflected a great deal on this issue. I must say that as a politician, I cannot say that I warmly welcome every single question that I receive. There are difficult questions, obviously. However, I can say that I'm more persuaded now than ever that having strong journalism and freedom of the press is essential for democracy. Because of the presence of journalists to bear witness to what is happening, who are present and have the power to ask questions of the government, every democracy, including ours, is stronger. Journalists and journalism are essential for democracy. Thank you.
Lee, follow up.
And Mr. Anand, the government has ordered close to 40,000 ventilators, but only 203 have arrived, a number that's remained largely the same for weeks now. Is there a problem? And in terms of KN95 masks, millions have been redirected outside the healthcare system. Where exactly are they being redirected, and are you allowing the resale of them to the public?
Thank you so much for those two questions. The first question relating to ventilators is a good one. You're right, we have received just over 200 ventilators. The contracts that we have in place for a large portion of the remainder are in place with Canadian manufacturers, as both Minister Baines and I have discussed at these pressers in the past, and they will be arriving over the next months. as these companies, some of which are retooling, some of which are starting up to do the ventilator production, are doing just that. And so you will see the numbers of ventilators on our chart on our website increasing over the next months. I will say that those ventilator procurements are in addition to the existing stock of ventilators that the Public Health Agency of Canada has. And of course, provinces and individual healthcare systems are making their own procurements across a range of PPE and other items as well. Moving on to KN95 masks, close to 2 billion masks have been redeployed to other areas of government. At this point, there is no plan to make those available for retail use. I want to remind you and everyone that we are still in the middle of the crisis, especially from a procurement perspective. And all of our procurements at the current time are based on federal and provincial orders that have come into us for delivery out to the healthcare system. There is a demand for PPE outside of the healthcare system, and we are currently devising a means by which we can be more broad-based in terms of supplies and use of PPE across Canada. Thank you so much.
Thank you, Minister. Operator, next question, please.
Merci. Our next question, notre prochaine question is from Manon Cornelier avec Le Devoir. Please go ahead, à vous la parole.
Question from Le Devoir.
Cette question est pour vous.
Mr. Baines, this question is for you. You announced the composition of your Industry Strategy Council. Just a moment, please. Now, on the Industry Strategy Council, that will help you to consider future perspectives. But what about workers? Are they not part of the industrial strategy? They're just going to be subject to the implementation of these strategies?
Allô?
Est en train de répondre.
Oui,
Nav, go for it.
Yes, he is answering now.
You
merci
yourself.
pour votre question.
Thank you for your question. The Council represents all industry throughout Canada. Our objective is very clear. We must have a strategy that can help the situation for workers, that can improve it. It's not just about the sectors, it's about the workers. Our strategy represents opportunities to have good conversations with workers. That is why we've mobilized leaders of every industry that can propose solutions for workers.
Les travailleurs, eux, vous voulez pas les...
Question. The workers, you don't want to hear from them? There's no union, there's no workers group represented on your council.
Encore une fois,
Answer. Once again, the council represents industry. It represents the private sector. The private sector creates the right atmosphere for workers. We will mobilize workers through unions throughout Canada. Absolutely, yes. I will work with my colleagues at Cabinet as well. And we will engage unions throughout Canada.
Merci, Monsieur le Ministre. Opérateur.
Thank you, Mr. Minister. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question is from Alex Bellington with the Toronto Star. Please go ahead, à vous la parole.
Hi, thanks so much for taking my question. Just on the syringe order, when will these syringes start arriving? And just the second part of that for Dr. Tam, if I can, do you think that in order for a vaccine to be effective, that it needs to be mandatory that, we have 37 million syringes coming in that basically all of Canada must be vaccinated when this arrives?
Thank you so much, Alex, for that question. The contract with Becton Dickinson, a new contract, and the delivery schedule is still being determined. But I will say that we are planning ahead for the eventual discovery of a vaccine. So the need for those syringes at this very moment is not as high as we are seeing across other PPE items. Having said that, we are working to procure supplies, including those syringes and other supplies that would be needed for the eventual discovery of a vaccine and its administration throughout Canada. But for the health aspect of that, I'll turn it over to Dr. Tam, who may have more to say on vaccine administration.
Yeah, so I think we don't know if we have an effective vaccine, but we need to plan ahead for that eventuality. So we have a committee, the National Advisory Committee on Immunization, that'll be looking at the framework for prioritizing the provision of vaccine to Canadians. And there's no requirement or mandatory policy from the perspective of the federal government. It is not something that we've, provided, even in, for example, the last pandemic of 2009. We do account for the maximum number of Canadians who may wish to be vaccinated.
Alex, follow up?
Just moving to the I guess this is for Minister Bain, the rapid testing kits. Obviously, there was a hope of getting some from that Ottawa company, Spartan, I think, recently, that kind of fell through. When will we see, or when can we expect to see rapid testing kits actually in use in Canada with these new research agreements and all this?
Well, thank you very much for your question. When it comes to testing, we know that it's important for the restart of the economy to ramp up our testing. We've looked at Made in Canada solutions for making sure that we have sufficient reagent and swabs for lab testing. We've also put forward solutions for serology and test kits for that. What I announced today are low-cost point-of-care diagnostic test kits. And these are going to be used for clinics, airports, particularly for rural and remote communities. And the objective is to get quick, rapid test results. But this is early stages with a proof of concept that's going to be developed. It still needs to be approved by Health Canada. So this is a bit of a long-term play. This is not something that's going to be up and running in the next few weeks. It'll take months. But the idea is to complement the other testing initiatives as well, and really to mobilize our innovative, skilled innovators across the country who are highly skilled at coming up with different solutions. And this is a byproduct of a challenge that we put out to industry to come up with new solutions. And you looked at saliva sample-based solutions, which are easier to administer, but we need to go through the appropriate due diligence, particularly with Health Canada, in order to make sure that we have the appropriate setup in place for clinics, for airports, for rural and remote communities. But this is a bit of a longer.
Thank you, Minister. We'll now turn to the room. Mackenzie.
Hi, Minister Freeland. Mackenzie Gray with CTV News. The Prime Minister has mentioned, and Minister Duclos even mentioned in his remarks, that we should be better allies for Black Canadians. I think that many Black Canadians and many activists would agree that being a good ally means calling out people for what they perceive to be injustice. Why has the government not been more forceful in its reprimand of President Trump's approach to how the protests have gone, and in particular calling in the army to potentially deal with protesters?
Thank you for that question. It's a really important one. Start by being very clear that racism exists here in Canada. As we heard Jean-Yves say a moment ago, systemic discrimination is real, anti-Black racism is real, and unconscious bias is real. As a Canadian politician, as a Canadian leader, my focus is on Canada, and it is on being very clear within our government and with Canadians that this is not a problem to which we are immune. It is a problem here in Canada, and it is our job today to listen to Canadians, to listen to Black Canadians, and it's time for us to act.
I must note, though, in the answers that, and the questions previous and the answers the Prime Minister gave, and then the response you gave here, you haven't mentioned President Trump by name. Are you concerned about blowback from the U.S. if we are to get involved in an issue like this?
What I am concerned about, actually, is Canadian complacency. I think that it's really, really important for us to set our own house in order and for us to really be aware of the pain that anti-Black racism causes here in our own country, of the reality that we do have systemic discrimination here in Canada. And I think that we as Canadians, all of us, need to take this very traumatic moment for many people in the world as an opportunity to look at what we are doing in Canada and to work hard to do better.
Merci, Madame la Vice-Première Ministre.
Thank you, Deputy Prime Minister. Operator, one last question on the telephone, please.
Thank you. Merci. Our next question, la dernière question, is from Mélanie Marquis avec La Presse. Please go ahead. À vous la parole.
Question from La Presse. Thank you very much. Hello to all. My question is for Ms. Freeland, having to do with the United States. Over the last few days, have you had any conversations with an American counterpart, such as Mr. Pompeo, in order to express Canada's concerns about what's happening south of our border?
J'ai échangé avec...
Answer. I did have dialogue with an American counterpart in the last few days. However, we discussed concerns about international trade and free trade. It was a very specific conversation.
We're in constant touch with our American partners. I very specifically have had some communication with American counterparts, very specifically about trade issues.
Mélanie, en suivi?
Oui, et puis, oui.
Melanie, a follow-up? Yes. Ms. Freeland, as a follow-up, I would like to ask about the laser operation in Quebec's nursing homes. Has an agreement been established between the federal government and the province of Quebec?
On est en train, c'est une très important.
Answer. That's a very important question. I would like to start by saying just how much I appreciate the vast amount of work that the women and men of the Canadian Forces have put in. I am proud of them, and I think all Canadians should thank the Canadian Armed Forces for what they are doing. I think we can say that we are talking about saving Canadians' lives here. As you know, we are discussing with Ontario and Quebec to determine how much more time the Canadian Forces will remain in place. The Prime Minister was clear that this is not a long-term solution. We must find solutions now because the Canadian Forces cannot stay there forever. Working on resolving the situation with the provinces.
Madame la Vice-Première Ministre.
Thank you, Deputy Prime Minister. We have time for one last question.
Operator.
Thank you. Merci. La prochaine question, next question, is from Catherine Nick avec La Presse canadienne. Please go ahead.
Canadian from the Canadian Press. Yes, hello to all of you. My question is for Ms. Anand and perhaps Minister Baines.
You would like Canadians to be self-sufficient when it comes to personal protective equipment. Is Canada following the trajectory that was initially drawn? Are we still going to need to import materials from other countries such as China?
Je voudrais commencer dans...
Answer. I would like to start and then give the floor to Minister Baines. We have a constant flow of goods coming from various sources, both nationally and internationally, in order to maintain the supply chain. We have contracts with national and international suppliers, and we need to prioritize the maintenance of these orders of equipment for all Canadians. That is very important, both in the short and long term, and we are being aggressive and proactive in our approach for Canadians. Nav.
Merci, Anita. Je suis
Thank you, Anita. I agree with my colleague.
continué à fabriquer l'équipement.
We will continue to manufacture essential equipment. For instance, we have 700 businesses throughout Canada who are manufacturing essential equipment for Canadians. I am sure that our capacity will continue to grow.
Catherine en suivi.
Catherine, a follow-up?
Ça n'a pas tout à fait répondu à ma question.
Yes, that didn't quite answer my question, which is when will we be self-sufficient? But I do have a question, and I would like to hear you in French on this. Where are syringes coming from? When can we expect to get them?
Nous...
Answer. We will make sure that we have all of the items that Canada needs. Goods such as syringes are coming in the short term. However, that is not the item that we are as concerned about. We need many things before getting to syringes. For instance, gowns, such as gloves, such as ventilators. We're focusing on those items now, long term. Thank you very much. That's the end of the press conference for today. Thank you, everyone.